Medical professionals of Reddit. Have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what's your story? I'm a vet. A few years ago, I had a client bring his young cat in complaining of lethargy. Besides being a bit underweight, the physical exam was unremarkable, so I asked more questions about the cat's diet. So, what do you feed the cat? And he answers with some online trendy raw food brand. How's his diet? Does he finish what you feed him? Yes, he always eats everything. How much do you feed him? A half cup. Once or twice daily. Once every 3 or 4 days. You feed your cat twice a week. I believe in a more natural feeding approach, and based on my research, that's how often cats eat in the wild. This owner was slowly starving his cat to death based on some cockamamie idea he'd made up watching National Geographic. I had to explain to him that domestic cats aren't tigers, and small wild cats eat 10 to 20 small meals daily. Surprise, surprise, the cat's lethargy and weight improved with regular feeding. You just know this dude thought he was so smart. Like, he thought he was saving so much money from this, and it's like, oh, my cat's gonna be so much healthier. No, you're just... What are you doing, man? Story 2. I'm in the ER. So many stories. The one that left me dumbfounded was a woman who was brought in by her sister for pelvic cramps, amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause and her sister staring at the ceiling, I told her no, because they speak Portuguese in Brazil. Patient seemed relieved and the sister hustled her out of the ER before I could discharge her. Story 3. I used to be a medical oxygen tech, mostly doing in-home work. One guy was on such a high concentration that he would have drawn nearly zero oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem just to keep him barely alive. This was explained ad nauseum to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He would take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way, so on and so on. Literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen. I lived not even 5 minutes away, right beside our EMS/fire station, and the call would always come for me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years and I still see the wife around town. She always glares at me as if I'm the one who ended him. That last part came out of frickin' nowhere, man. Well, kinda. Like, you could see where it was going, but I didn't expect it to be like that. I don't know. OP didn't even say that he passed away or something. Just he shut the machines off before going back to bed. My brain didn't put 2 and 2 together until I read the last sentence. So I had to go back and reread it because I had the intention all wrong in the line. That really threw me for a loop, man. That's brutal. Story 4. Lady brings her baby into the ER with a rectal temp of 103. Kid looks like crap. Refuses all medication. Says she doesn't believe in them. And wonders why her herbal tea, she brought a jug of it, isn't working. Wants us to just check her out. Thinks a children's emergency room just checks them out. Tried to explain why the kid needs an NSIAD. Keeps refusing. Says she doesn't know what's in it. I bring up the fact that she had her kid in a hospital, and that she received medication herself. IV, epidural, etc. Doesn't budge. Only concerned for herself. Told her that when the kid has a seizure or goes unresponsive and you call 911, you can expect the medics to give the kid everything it needs regardless of whether you like it or not. Only when the doc threatened to contact social services for child endangerment and abuse did she start to listen, for like 5 whole seconds. Left against medical advice. People like this exist and breed. Story 5. I worked ED for 10 years. Every day is the answer. Every day people come in and it shocks you how they've managed to evade death for that long. One of the worst we had was a guy who came in. He was a twin. He told us he needed to get checked for STDs because his sister apparently got one. We of course had to ask if he banged her. He said no, but they were twins, so what she has, he does too. After a collective sigh of relief that this wasn't some weird Alabama stuff, we had to educate him that that is not at all how it worked. Story 6. Something in the intimate education system is so vague that it's failing people. Because when I worked at an STI/HIV clinic, there was a not insignificant portion of patients who thought you always risk an STD from banging at all, regardless of whether the partners are virgins, tested, etc. Had a virgin ask if they could get HIV from banging with another virgin their first time. I had to explain that STIs had to come from somewhere. Someone has to have one to transmit it. They don't just manifest from the act. Edit. Due to many comments, I feel the need to add that yes, I was trained in HIV testing and counseling, and Ryan White certification, so I know that you can get HIV in utero, from transfusions, or from IV drug use. This just wasn't the case in this patient's scenario. I tested them myself and they were negative. Also, I want to clarify I don't mean to ridicule the patient at all, just commenting on how lacking intimate education can be. Story 7. 73 here. Former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Walks in with a paper request for seed analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional, and I've done this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge then. I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He couldn't/wouldn't believe that I was asking him to finish into a container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back. Patient provided improper specimen. I could not help but laugh at the end. Yeah, that's the improper specimen, all right. That's one way to put it. Story 8. Optometrist here. Patient booked in for an emergency appointment with a raging red eye. Clearly very painful. Look under the microscope and the cornea is really not happy. Wobbly reflexes, haziness, the works. Me. What happened? Patient. It's my niece's wedding this Saturday, and I wanted to tint my eyelashes to match my hair and the color scheme of the wedding, light blue. So I used the same dye for both to match the color. Does that hair dye contain ammonia by chance? I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Unless you can convince them to change the color scheme to red, no. Edit, because I read a comment about healing crystals and now I remember a story from a colleague. Patient attends a routine test complaining of gradually reducing vision, which turns out to be due to cataract. My colleague offers referral for surgery. No need, exclaims the patient. I know what I need for this. I have lapis lazuli at home. 6 weeks later, came back for the referral. Second edit for remembering the first story that made me question my sanity. Elderly patient attends with concerned family members because the patient ran over a pop-up tent in the side of the road that the telephone engineers used to protect themselves from the rain. Luckily, no one was hurt as the workers were on lunch. Worried as to how the elderly driver missed seeing a large red and white tent in the middle of the day, it was then that the elderly relative admitted to having spent the last 3 years driving from memory. Story 9. EMS here. Had a diabetic in his 30s to 40s who refused to take insulin since 2012. It was 2020 at this time. When I took his blood sugar, it only read as high, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high, and then went, "Is this because of all the ice cream I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later in the parking lot after he got discharged. And it took this man less than 50 paces from the ER door to rip off his bandage covering his IV and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze, so that hopefully, by the time he got it off himself, it would have clotted enough for him to not end up exsanguinating himself again. Story 10. Not a personal experience, but one from a colleague of mine. I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned. He recovers. Every care and med that he needs to take are prescribed, explained, and medical appointments with a cardiologist/arythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment, and never answers any calls from the hospital. This went on for around 3 years, until he shows up without former warning and asks to talk with the doctor that did the procedure to put in his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside of his shirt. The man explains he's been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off, and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker that should have been kept inside of his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it, with the pacemaker leads still inserted into his veins and connected to his heart. Nobody has any idea how the man let that situation come to be, or how he didn't die of sepsis or any other health problem that may appear for that matter. I like to think that there are clear signs to see a doctor. A pacemaker being on the outside of your body with a giant open wound, I would think falls into that category a little sooner. That is simply not going to fix itself. I don't know any other way to put it. No one else can help you. Please see a doctor earlier. Oh man. Story 11. I don't know if a cleaner in a hospital counts, but this one time I got to work early on a Saturday morning, and we immediately received a request for help from the ER, and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind the curtains. He was shouting at the nurses, "Don't touch my dong!" and "I didn't use any drugs!" Then I smelled iron in the air, and then I found out there was blood all over the hallway. Handprints in blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I've never seen that much blood before that day, nor after. Story 12. I'm a pharmacist. One evening shift I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. Man. I had intimate relations with a woman I do not intend to pursue a long-term relationship with. Yes, he said it just like that. Okay, I'm assuming there was an accident or it was unprotected. How long ago did it happen? Last night at 7 p.m. on the couch. Whoa, TMI, I just need to know the approximate time to know if Plan B will work. Well, we have this medication called Plan B, and since the incident happened within 72 hours, oh yes, I got that for her already yesterday right after we finished. We want to know if there's anything we can do to know if she's pregnant now. Unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period. And if she doesn't, then she can do a pregnancy test then. Theoretically, you could do a blood test for faster results, but that would also not be until a couple of weeks at least. We're just really anxious because she really doesn't want to be pregnant. Is there anything she can take to prevent the pregnancy? Any multivitamin, minerals, food? She's already taken it. It was the Plan B. There are some other options, but those are prescriptions. And no, there are no over-the-counter products she can take. What about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? No, sir. There isn't anything you can take now. Well, he's trying his best. Gotta give him that. Story 13. I overheard a conversation between a nurse and a doctor and a patient in the ER. They were trying to figure out if he was very stupid or has a head injury. It was both hilarious and a bit sad. He kept telling them he was there for a hurt leg. He couldn't explain why his leg was hurt, how he got there, or anything. I heard them talking in a hallway to each other. The nurse was convinced he hit his head. The doctor said, "No, he's just an idiot." Turns out the doctor was right. They get a hold of the guy's wife. She basically told them in the hallway he is always this dumb, and if she leaves him, he would get lost in his own house and starve. Story 14. Not me, but sibling. I don't think he'd mind me sharing the story just on the off chance it prevents someone else from making this mistake. Lots of surgeons have a similar story, but thankfully this one doesn't end in someone's death. Parents claim their child hasn't eaten anything before surgery as they were carefully directed. Turns out they thought the surgical team was just being cruel to their child, and when she said she was hungry that morning, they detoured on their way to the surgical center and got her a full Southern breakfast. She damn near died aspirating biscuits and gravy. I've rarely seen my brother so angry and disgusted. Somehow biscuits and gravy look even more nauseating the second time around, and he was just recounting what had happened. I have no doubt he tore a strip off the parents once their 5-year-old was stabilized. And they probably still feel justified and angry at the surgeon for telling them what they could and couldn't feed their child right before anesthesia. Edit. The parents did in fact feel justified and hard done by. although as far as I know, they didn't express anger at my brother. Knowing him, they wouldn't get a word in edgewise. Definitely no acknowledgement or realization that they could have easily ended their own child, or that they made a bad decision at all. I remember they were annoyed by her whining for food. Story 15. I work in clinical research at a hospital, basically for patients who have cancer and don't have other standard of care options. Clinical trials, experimental treatment, are a viable option for many. Some people have a negative view of research, but it's highly regulated, and not as scary as it sounds. We go through the consent form with this patient who has a history of drug abuse. We don't know everything about this new medication, but one thing we do know is that using coke while taking this drug will make your heart explode in layman's terms. This patient promises they're off the sauce, and that they totally won't do coke while I'm on trial. 2 weeks later, they relapse, and, well, you can figure out the rest. Story 16. I'm a dermatologist in India. As is the culture here, people eat with their hands, and almost all of our curries or even other dry side dishes have a lot of turmeric. It is common knowledge to anyone born and brought up in India that this means the nails of your dominant hand, statistically the right, are going to be yellow stained, because we've seen this happen since our childhood. Usually this wears off in about a day and a half if you wash it a couple of times. Cut to the first patient in my OPD, a young girl in her early 20s, very anxious. What brings you in here today?
Doc, my right hand fingernails keep getting yellow discolored.
Only right hand?
Yes, and only after meals.
Do you eat with your hands?
Yes, always.
So, you know it's just turmeric, right?
Yes, but can you make it stop happening?
For God's sake, use a spoon.
So you mean there's no medicine to make it stop?
No. This might hit home more with people of South Asian cultures or people who habitually eat turmeric-cooked food with their hands. Anyway, for a grown freaking person to complain of this was just, well, surprising and a little ridiculous. Story 17. Okay, so not a medical professional, but hear me out for a second. I work in a gym and recently had a client come in for an induction. Basically, walk through the gym, design a program based on goals, needs, and physical capacity. The client in her late 70s has a shoulder injury, which the physiotherapist has said, the rotator cuff is barely attached. Client has been suffering in severe pain for years and hasn't been able to use that shoulder, and refuses to go to the doctor as she doesn't want to see a surgeon, doesn't want surgery. I've echoed what the physiotherapist has said, and have refused to do any upper body exercises because of how bad the injury is. The client would rather live in severe pain than seek necessary medical treatment, and only takes pain relief medication when the pain is intolerable. Story 18. I worked in cancer research/surgery a couple of years ago. There's a good amount of people who will refuse to have a small removal/surgery because they think holistic medicine or praying it away will work. They always come back, and we always have to remove so much more. One time a patient had a melanoma on their calf, and the doctor wanted to do a simple wide excision, but they left because they wanted to pray it away. Came back a couple of months later because it got bigger and we had to amputate their leg. Pretty sure they had positive lymph nodes at that point too. Just a friendly reminder, even though I am not of faith, that the Bible, at least if we're talking about Abrahamic or specifically Christianity religions, does specifically talk about doctors and doesn't say they're bad. Pretty much, listen to your doctors. Praying it away will not work. If even God is telling you to just go to a doctor, I think you probably should. Story 19. My wife used to work at an urgent care in an undereducated community. I'd guess most of her patients would have you wondering how they made it to adulthood. Some notable ones. 1. The guy who, after learning he had diabetes, vowed to make a life change and replaced all of his soda with Gatorade. 2. Women who don't know anything about their parts or menstrual cycles. 3. The people who come in with a history of heart attacks and chest pain that feels like a heart attack, but I know my body and it's not a heart attack. Spoiler, it was always a heart attack. 4. Guys with gross dongs, hygiene related. 5. People who did their own research. 6. People who didn't get their normally not complainy teenage daughter medical attention when she was screaming in pain. After finding out she had appendicitis, they took her home, instead of taking her to the ER. Her appendix ruptured that night. Bonus. My kid was in the hospital and sharing a room with another patient. This kid was morbidly obese and was elbow deep in a family-sized bag of potato chips. The doctor came in and really gave it to the mom. Your kid has a kidney failure and he's not supposed to be eating salty foods. And your kid has a major condition and you've missed the majority of his appointments. Undereducated community work is tough for this reason exactly. Not that I know it firsthand, admittedly, but I'm just saying, in general, because of the lack of education, they're just gonna know less, by definition. And also, as such, I think it's important to not treat them as stupid. They were just not given the tools they would need. So I don't think making fun of them is the answer, but educating them absolutely is. Story 20. Physiotherapist. For those who don't know, after a total knee replacement, you basically have a 6-week window after the surgery to regain the range of motion. If you don't in those 6 weeks, it ain't coming back. Had a patient who was a farmer who was very enthusiastic about regaining the range, because he needed to be mobile for his work. Saw him the first time about 5 days after surgery. Showed him all the basic exercises. Told him to not do any farm work for at least 6 weeks. And told him to come back to see me once a week for the first 6 weeks. He disappeared and came back about 8 weeks later. His range was non-existent, maybe 30 degrees of range in total. He was visibly mad at me, as if it were my fault. He was actually shouting and calling me incompetent. Our conversation went something like this. Have you been doing the exercises? No. How often are you doing farm work? Every day. Why haven't you come back since the first appointment 8 weeks ago? Too busy with farm work. So, to summarize here, you did absolutely nothing I told you to, and this is somehow my fault. Never saw him again. Story 21. Not a medical professional, but I used to volunteer at a free medical clinic to take vitals and histories. A woman came in with pneumonia and wanted to know why her normal treatment of drinking half a bottle of Listerine and smoking a pack of cigarettes a day wasn't working. I asked her why she thought smoking was a good treatment. She said,
Indians used to purify the ground by burning all the weeds away before planting, so I'm smoking to purify my lungs.
I left that one to the doctor. Story 22. Not me, but my ex-wife works as an endoscopy nurse. People have to use laxatives because they have to be clean for the doctor to be able to see with the camera. With the laxatives, they have to drink a lot of fluid. 3, maybe 4 liters total if I recall correctly. About 3/4 of a gallon to a gallon. Some people just don't do it because it tastes bad. Some people do laxate but still eat. Some think the doctor just won't notice. Yeah, Margaret, they totally won't notice that your colon isn't empty when they go in there with an HD camera. They just don't understand why they do it, even though everything is explained by the doctor. And they get brochures and a link to the website via email. And believe me, I've seen the brochures and website. An average 80-year-old could understand. Also a funny story from her. There was a teenage boy brought in with a fake dong stuck up his butt. He didn't need surgery, but they did have to use some tools to get it out of his rectum. After the procedure, he apparently asked for the toy back, because it was his sister's. Answer was no. It was cleaned and they have a trophy cabinet. Story 23. As a pharmacist, everyone who comes in to buy homeopathic crap, especially for serious things. Once a lady came in with a prescription from the dentist for some heavy antibiotics and painkillers due to an infection that had threatened to damage the jawbone. When I asked if she knew how to take them, she went, "Oh, I'm not going to take those. They'll go right into the garbage. But I gotta buy them so my dentist is happy. I'll rather stick with insert name of homeopathic crap here, instead of poisoning me with some devilish chemicals." Throughout the years, I've learned to just shrug it off and accept those Darwin Award candidates instead of arguing with them. Just infuriates me when I see they've got children and or pets. Story 24. Just got reminded of the time I got a highest priority call to someone who was actively choking. Rushed to the scene. Going through the protocols en route. Plans for if we needed to perform CPR. Pull up, rush in. Dudes sat on the sofa, fully alert, not choking. Me. "Ah, you've managed to clear it. Great." "No, I'm still choking," they said with no hint of choking. Also, if your airway is occluded, you couldn't speak. But the story is he'd been to the local carvery for lunch. Ate a big bit of beef that he felt was too big to swallow, but swallowed anyway. After a short while, he felt it was still not fully descended to his stomach, so he drove himself home and called 999. I explained that it was a large bolus of food in his, for simpleton speak, food pipe, not his air pipe. He needed to drink water to wash it down, and next time either cut smaller pieces or not swallow. He had 2 young children and a 3rd on its way. These people are allowed to vote, drive, and reproduce. FML. Okay, well, little narrator's note here. I think it starts to get a little dangerous when you're like, these people shouldn't be allowed to reproduce. That's a bit dramatic. Although I completely understand the sentiment, trust me. But this one is, it's really lacking common sense. It's what the thread asks for. I feel like there are a few in here that's like a level above common sense. Not much, but barely. This one is just right on common sense in my mind. It's like, no, you're not choking, man. You can still breathe and talk, and being able to breathe is probably the biggest indicator that you're not choking. Just strange, man. Anyway, that is also the last story we have. There were some very, very impressive ones in here. There are a lot of other words I could use other than impressive, but they're a lot less, kind. And I like to think of myself as a kind lad. So I'm gonna leave it at that. Impressive. There's impressive behavior in this thread. Anyway, I hope you had fun listening to this video. Or learned something. Who knows? Medical videos, it's always very possible. And maybe there was something in this thread where you're like, I feel like this is a stupid question to ask, so I'm not going to. And then you learned about it in this thread. Congratulations. Learning is great. I think true stupidity is refusing to learn as opposed to not knowing things. That's my take. But for now, thank you so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.